An average assessment would generally take probably about 15 to 20 minutes until a prescription's generated. After that, the software, if you're using the software, will generate the prescription, and then the technician will take it, or whoever is working that day will take it and just fill it like a regular prescription. One thing that would help reduce time is if you're in a really busy practice, is if you actually have, when they call in to ask for an appointment for a minor ailment, or if they can come in, if you have your technician quickly take down all their basic information and open up the profile. Because I feel like that's probably the most time-consuming step. You do not have to use any software. I think that, again, to get over that initial fear, the software is very beneficial, especially for older pharmacists or pharmacists that have been practicing for quite some time now and they don't have that confidence. So in terms of accessing lab records and looking at patients' medical history, you don't need to access it that often because, again, these are minor ailments. They don't really require lab at this stage with what we've been given, our prescribing authorities. The minor ailments don't really require any lab workups or anything like that right now. So at this stage, it's not that important. It's more important when you encounter a patient that possibly doesn't speak the language that great, or possibly can't remember what medication they take regularly if they're not your patient, or a situation like that, or they can't remember if they've tried this medication in the past, or you can access records for those types of things. We don't do anything physical apart from using your eyes. If somebody's going to show you their rash, you can visually look at it. You visually can assess a cold sore, a tick bite, anything like that is very easy to see. But in terms of touching or feeling, we don't have to do anything like that. You don't have to, it's not, again, because it's minor, it's not required. We're not diagnosing. We're basically confirming the suspicion that the patient has because they've had this ailment in the past that is actually, in fact, this ailment.